Good morning and welcome to the new edition of Frontiers of Knowledge. Health, medical care are our prime concerns. So today, why not talk about some new developments in the medical sciences that can be a boon to the people who suffer? And tell me, who among you doesn't fear going to a dentist? Apart from all the archetypal stories regarding the pain caused by the dentist, the huge bills of the dentist come as a shocker. And now, do you know that your cavities can be repaired and regrow your teeth? This would be quite a bad news for the dentist and good news for you. The doctors have found, the researchers, that a medicine used to treat Alzheimer's can promote tooth repair. You know, this is tight glubbish tablet, and they replace the cavity with that promotes new dentine production and natural tooth repair. Goodbye to the fillings. You know, if you look at the ash deep of history, you would find that the cavities in the teeth have been as long as the Neolithic man. But the new discovery has been developed, trials have been conducted. What they do is they stimulate stem cells in the pulp of the teeth, which is the source of the new dentine. And what is dentine? It's a mineralized substance beneath the tooth enamel that gets eaten away by the tooth decay. So what they have done is the researchers team inserted biodegradable sponges made of collagen soaked in tidal gloves into the cavity. And within 6 weeks, the cavities were as good as new tooth. This is a great breakthrough in the dental clinics. There is no drilling, just the biodegradable sponges of collagen, made of collagen. They are soaked in tight glove chip and then placed in that cavity and left there 6 weeks. This glupsin-soaked collagen sponge activates and triggers the dentine formation. And what happens is, this is biodegradable. The collagen structure of the sponge melts away and an intact tooth is left behind. The simplicity of this is there's no drilling, there's no root canaling, just plain simple placement of stem cells triggering them. That, of course, is one major discovery, I'll call it, because the things were already there, but it's basically a research. And do you know, by the way, that your cancer cells can be killed by the tiny robots? Tiny molecules are drilled into the body. They go to the cancer cells and blast them open. And it has been seen that the nanotubes, the nanomachines which blast these, are tiny. 50,000 of them combined would be the diameter of a human hair. That's how small they are. But they have potential to attack all the cancers in the human body. Durham University in UK has used nanobots to drill into the cancer cells, killing all the cancer cells in just, be prepared, in just 60 seconds. They have done it in the laboratory. Now what they are doing is they are testing it on the microorganism and the small fish, and then they will move to the rodents and the mice. By the end of the next year, they'll be experimenting on human beings, and the result would be that the millions of the lives would be saved. And how does it work? These tiny molecules are inserted into the body, and these are so activated that they identify and attach themselves to the cancerous cells. Then, they're activated by the light, and rotor-like chain of atoms begins to spin at an incredible speed. The speed is 3 million times per second. So these rotor-like chain of the robots and the atoms they are in is spinning at 3 million times per second. And that causes the nanobots to drill into the cancer cell and blast it. It's an explosion, and they are blasting. This is a new form of treatment. There'll be no side effects like in chemotherapy. There'll be no remission and no relapse. And once developed, it will be a potential of the non-invasive cancer treatment, improving survival rates and patient welfare globally. The destructive properties of the nanobots make them perfect for drilling and killing cancer cells. But then there's another benefit. These very nanobots can be used to repair damaged and diseased tissues at a molecular level. They go into, say, your liver is diseased, they go into that, and then they repair that. Basically, it is said that these machines could potentially patrol the circulatory system of the patient, of the human body. They'll automatically identify, detect specific chemicals and toxins, and give early warning of the organ failure or tissue rejection. So it's really a preventive medicine, a preventive Medicare with the help of nanotechnology, activated by the artificial intelligence. We shall do that. But that's not all. This has another function as well and benefit as well. And that is that the medicinal benefits are there, but industry can also benefit. For example, oil and gas. The idea is that nanobots could be injected into rocks, into geological formations, thousands of feet deep into the earth. Changing the chemical makeup of the machines would point to the reservoirs of oil and gas. Then that can be drilled and oil and gas recovered. They are also invaluable tool in cleaning up oil spills. So environmentally, they are extremely useful. I know that it's a long journey, but the very fact that the first steps have been taken, we can be prepared to foresee a potential impact on the world. These two developments would have been sufficient, but then I was amazed that we can treat diseases much more easy rather than giving medication, injections, and invasive surgery. Now a new technique has been developed in the University of North Carolina. That is use of light, plain light, and vitamin B12. What they use is light is used to activate a drug stored in the circulating blood cells that is released exactly when required. The biggest problem has been the drug delivery. You take it by the mouth, and the side effects on your esophagus and your liver and digestion are great. You take it by intermuscular route, that the pain and the whole headache of penetrating the skin, which you can't do yourself, is there. And now, this system, where the drug delivery is deprived of all these negative side effects, isn't that a cool factor? Using light as a to treat disease has many benefits. And as they say, they include avoiding surgery even. There's no risk of infection. Anesthesia is unnecessary. And people can treat themselves by shining a light on the problem area. Suppose you have an arthritic knee. You don't have to go to an orthopedic surgeon for knee replacement. Shine the light on the area where it's hurting, and you are cured. You see what Professor Lawrence at the University of North Carolina and his researcher did was, they took a drug molecule of vitamin B12, loaded into the blood cells, and that could circulate into the blood cells up to 4 months. So it's a reservoir of medicine is in the blood cells, can be used as and when tapped. And then, there was a technical hurdle. The hurdle was that if you use long wavelength light to penetrate the body, then it could not penetrate deep enough it could, and it could break it. But they do not have the energy enough. So they then developed the short wave light therapy. This short wave light has more energy, cannot penetrate as much as a long wave can, but sufficient for treating the tissue. So to activate this drug with long wavelength was rejected. They used the short wave light, activated it, and lo and presto, everything was okay. That's the trick. Now, what is the energy problem has been solved by introducing a weak energy bond between vitamin B12, drug, and attached fluorescent molecules to the bond. That fluorescent molecule interacts with the light when it's there. It acts like as an antenna. So receives the light signal, captures a long wavelength light, and then uses it, converts it into short wave, and then uses it on the bond between the drug and the vitamin carrier. Now what happens is that bond is cut and the medicine is released. Amazed. So we have talked about the three things which are quite a change. And this change is a change for the better. But just one fact which I like to talk to you. All of you have smartphones, and the biggest problem is charging them. I was shocked with happiness that the Fudan University in China has developed a way to harness electricity from your bloodstream. Again, they use nanoscale carbon fibers, and they use the inner space within your body. So blood is used, the drop of blood is used to charge your telephone. It's like a hydropower, which is flowing in on the water turbine. So blood is flowing in your body. And they are able to harness 20% of the energy generated by the blood flow. They have still not revealed the details, but they say it's an extremely easy process. That energy is flowing, a special carbon nanotube will be inserted in the body, where you will prick it, a blood drop comes out, and you connect it with your smartphone, and the smartphone will be charged. How far it will correct, I don't know. But let's wait and watch. Nevertheless, these developments show that health issues can be solved much more effectively, much more easily, much more without further harassment, without further botheration, and without harmful side effects. Have a great time. Thank you.